We make two measurements with single fiber EMG recordings. The first is the measurement of fiber density. Fiber density is the physiologic equivalent of type grouping on the muscle biopsy. It tells us how many muscle fibers from a given motor unit are concentrated near the electrode recording surface. And the measurement of fiber density is based on observations made during studies using multi-electrodes that led to the conclusion that the muscle fiber is within 300 microns of the recording surface if the action potential is greater than 200 microvolts and has a less than 300 microsecond rise time. We can then use the number of spikes that are recorded with the single fiber electrode from a single motor unit to quantitate the concentration of the muscle fibers near the electrode recording surface. This diagram will hopefully clarify this concept. Here, the electrode is close to a single muscle fiber. The semicircle represents that 300 micron diameter recording territory, and we only record a single sharp spike from this single muscle fiber. If the electrode is placed in such a way that there are two muscle fibers within the recording territory that are activated by the same motor unit, in other words, they are innervated by the same nerve, then every time one of them fires, the other one fires as well, and we see two spikes on the screen. Similarly, in this diagram, you can see what would be the case if there were three within the recording territory or four. In the first circumstance, we'd see three spikes. Down here, we'd see four. So the technique of fiber density measurements is based on this understanding. The way it's performed is the electrode is inserted into the muscle while the patient slightly activates the muscle. The electrode is positioned close to a single muscle fiber, and we know it's close when we see a sharp, clear spike that doesn't get any larger when we very slightly manipulate the position. So we optimize the recording position of the electrode so that we get a maximum amplitude single spike. At that point, we look to see whether there are any other spikes time locked to that triggering spike. And if there's not, then we record this recording position as having a fiber density of 1. We then move to another site selected the same way. And if there are two spikes, we record a fiber density of 2 for that position. This is done 20 times within a muscle. And the electrode is moved to make sure that you're not recording the same motor unit every time. Record 20 different numbers for the fiber density at each of the sites. Add those numbers up, divide by 20, and you've got the fiber density. Fiber density values vary among the different muscles in the body, from a low value of a little over 1.2 for the soleus muscle all the way up to a value of over 1.6 for the sternocleidomastoid. So when you are measuring fiber density and you want to determine if it's normal or not, you compare it against the normative values for that muscle. Fiber density increases with age, particularly in distal muscles, as these muscles undergo the age-related neuropathic changes. Here are fiber density measurements made from a large number of normal subjects. This is from the extensor digitorum communis muscle in the arm, the normal value for which is around 1.5 up till age 60, and then after age 60 the values begin to climb fairly dramatically up towards age 90. And the changes with age vary among the different muscles. For example, facial muscles here, the orbicularis oris, they don't change very much within these three age groups that have been measured, less than 60, 60 to 70, or over 70. But at the other end of the spectrum, the EDC and the tibialis anterior muscles have quite a dramatic increase in fiber density over age 70. So not only must you compare your fiber density measures with normal values for the individual muscle, but you also must take into account the age of the patient before you can use fiber density measurements. Fiber density measurements are used as a very sensitive assessment of reinnervation, because fiber density increases when reinnervation occurs, and in fact is a more sensitive measure of reinnervation than is type grouping on muscle biopsy, and considerably more sensitive than measurements of the motor unit potentials recorded with concentric needle electrodes. Fiber density also increases in some myopathies due to factors such as fiber splitting, but not usually to the same extent as you see with neuropathies. There's some myopathies in which fiber density is very markedly increased. Chronic myopathies, Duchenne's dystrophy, for example.